Ublat sa Nunavut miu. Ubdumi mutikin lugu takwa hitamat na nguyut nuvat na yakap tu amihung warak tu Nunavut iluani. Kangas senang mi pingahun ni amihung waktu amatikira rami atau he. Ama Nunavut iluani mana mutikin lugu takwa katiluk ta lugu nuvat na yakap tu 132 nguyut. Matakwa atay mga bigyan mata malik daw nuvan na yakang mangata 4,644. Matakwa nuvan na yakang ni mangata malik daw yuhuli 933 nguyut Nunavut iluani. Awi amiu tikia amiu kaya sinak miu kau yiba yung matakwa Nunavut miu tat ikayak tuing matay lipin ni ikpiguho kataw sudit hungit siya na api kau yiba yung Nunavut miu mut lukta mat nawak pakatai ko anala chata matakaw yung mga mata ko anya kak tailitichi kud malik taw ko yang ni takwa inutu ila kating alwak tangin luta ubdalung luta ang gabo ang migtalugit ani lwak tangin luta takwa malik taw cha matakaw yung mga mamat na pa Nunavut miu talukta kaw yung mga tana yung naktuk yung tana maligar lugo inutu nilo ila kating atangin luta Awi mga mata nunavut miu tigu kating ngaguan yugapta ilagi tigut may pakanda tigut kihani tana ihumagi luguman na akola uluta tawani hiwinik kami numan na riwa halagi gup tigu taikwa kating ngamek tu luak ta umalang mingapta tawani hiwinik kami kihani man na yotakwa kanok ilok kahigayabut aktuay na kang naman kanok Aku niyo tigo yuta ko kating nga kakayang yung mga tanuwan na kayo tayo mautid lugo. Matay ko ilangit kating nga mga tana patahuli ilangi ubla lumaya tanak pahuli maananok pakawi yagaluak tapinok kagakak tigo tana nuwan na kayo inung mga tao mo inuk kanyang mo ay tuloy hokap tatana tayo ko naluwa yun nuwan na kayo ang inglihok man. Tamap taluk ta ako lo tatakwa bila katigi lo tanala luk ta lo tana nuwan na yo kihene te ahala gene raptigo aniga kan ni nero iglo yang ni ani tailid ai hima merlo te ko aniga kan lo abi ku ni wera ka ko hunu mi ka ai sara ka wa taw na iglo yo elwani ani talo ni amma takwa Iqaluit tigi luta takwa ay tolong itu nuvan na yo mi halagi ni arap tigo tan nuvan na yo Nunavut miu ilipini ama ilap ni kamagi charlota hungi charlota pinapu mat na yo he. Good morning. Today Nunavut has 4 new cases of COVID-19. There are 3 new cases in Rankin Inlet and 1 new case in Will Cove. Nunavut now has a total of 132 active cases of COVID-19. The total number of persons followed to date is 4,644, and there are currently 933 persons still being followed. Iqaluit, Will Cove, and Rankin. We're all supporting you from all across this territory. Nunavut Mute, thank you for your efforts over the weekend to adhere to our public health measures. Please keep them up and stay vigilant. I know it's hard, but we need to stay apart so we can all come back together healthy and well. We need to think of everyone, our whole community, rather than ourselves. This pandemic is forcing us all to look at the bigger picture, and we all have responsibilities. It's our individual actions that will slow and stop this virus. If you are still socializing outside your household, please stop. It's time to practice community care and consideration. We all knew this would be hard, but we all need to do our part. We know what to do, and we know the consequences if we don't do it. If you don't need to leave home, just don't. If it's not essential, don't travel. Don't take chances with your health or anyone else's health. Stay well, stay safe, and stay home. Thank you, Nunavut Miu.
Blakut, Nunavut katika. Kawai magapta takwa nuwagjuang 19 kaktut amisungok palian rayangin nik kisiyani kawai mablungan ay sumalok luktang ay utamatu amiksano kisiyani tam na ito sa iyo Dr. Patterson o kasi bang mawap tinun tayo man na niya kasugilaw magin tan nalunay ay baldiang makanok rap ko tamatuming kinaktut nuwagjuang natakatumi kinaktut kawai saktut pilirit siyang narayang ataguna udsang nangmat amatay ko nuwagjuang nakaktut kawai yaw baldiang mata taman na koreanakto. I know the increase in the number of COVID-19 cases we have seen over the last week has many of us worried. As Dr. Patterson has told us, this is not unexpected, and it shows our health teams are working hard to find everyone who has the virus. It shows that the contact tracing is working, and yes, it will take a while to get everyone that needs to be tested. Iqaluit ako magibungalo takwa ukausiyo waktu takane nasa utit kapsiyo lang mangata kitudun wagjuang takalang mangata ukausiyo kataktut tap kunangat gawa magkuningang ikangata ukausiyo katangin luit siya may baldia tuin nang mat tusang naglo tao unik sulingit tuniglo taman na ulo kaya naktuyun nang mat ublu tamatya ngila ukakatigiyabu tamakwa nunakatibu hamle kudlusibulak tingit ukakatiga kataktabu tusaw madityak tutigut takuning anasaw tinig kawai valdeyap tinnig kisiyan ilip sinuwi kayok taw yakayakang mayugun kawai mayunga ay simay nang takanak tuarog aksoong naktuarog dunilu kisiyan ubagut taw nang minak ikayokayakak tigut tam na siya makan na kung ikup tigut tusak simayabu tam na ito aksay Dr. Patterson o kakto tam na ay tu tigi yun nakang ni ino katingnut kawai mangidlu tidlunit tam na anyak pisiman na suwing idlu ay tu ibaldia yun naktutin kawai yawlaw kaktindak tap ko tagwa pidyo tigi blugit maligya kalwa o tigi yabu tap kuninga ay simaya kaya kang nangmig matwa simaya kaya kang nangniglo. I'd just like to remind my fellow citizens that it is important to get accurate information. Please don't listen to the rumors and social media comments. Rumors just spread fears. We are communicating with the public every day, and we're meeting with the Hamlet leadership on a regular basis to make sure you have accurate and up-to-date information. But we need your help. I know it's hard to stay home. However, we must do our part in containing the spread of this virus. You have heard Dr. Patterson state that you can pass the virus on before you even know you have it, before you have a positive test. That is why it is so important that you follow the rules even if you do not think you are sick, and especially when you are at home. Taikualo kablunano nang ano inutusibing ni kataktu taw nung ngoni aktu taw na nito nigluto sayo kasang nagpat kawaya mayugo inutusibing nito ni kawaya nang nito akso kong naktok kisya ni taika ni atok tatit ikping nang nekang niya mayuno na bumiutang no malingi kuwit taiko inutusibing mi tut maligya kaktangin ni inokatitit no na bumitu ulo kaya naktumwaktit tun naktatit kablunano nangan nitlo ni inutusibing nitlo ni holiday ng ngitok ng reaktor ngitok maligak saktalik taw na ni taikualo sa komentary kang ikalwak tatit maligya kat siya kalwak tatit taikuano nakatibuno na bumitut ulo kaya naktumakong ikuptigon taw na nang nitaw agatir mitsyalugin kani matuak si malugo taikuano nga niaway kutinig amma ugla ka katangil tuli kaglilo akta ililo titaw na niya katigayang ni sigalin niglo imiyarong nigdusunan ni amet kakatangil sitaw na nipsin ni. I'd also like to send a message to fellow Nunavut mute who are in isolation in the south or going to isolation in the south. We recognize how difficult isolation can be. Your actions make a difference. If you are not following the rules, you are putting people at risk. Isolation in the South is not a vacation. There are rules. Breaking the rules puts your communities and your loved ones at risk. So please always practice social distancing, wash your hands, don't go visiting, don't share cigarettes or drinks. We are all used to doing many of these things all the time, but we have to stop and carefully think about our actions. We need to break these habits if we want everybody to stay healthy. We all must work together to prevent COVID-19 from spreading. We must act to protect ourselves, our families, and our communities. Our actions now affect everyone's health all the time. Tamakua atula naringit lugit malili naringit lugit ayong naktua puyo sakay naktukulo kataktu kisiani maligya kaktabu bila katigit chaya kaktugut tam na sali gine oktigut nubagjuang na amasya makungit kuptigut nunak katigitigut ino katigitigut katangutigitigut taman na siya maktitay law labut bila katigit chaya law ta ino katigit chaya law talo aneng chaya on mangyao nunabumi koyan namin.
Good morning. Today I want to talk about the way this virus spreads and reinforce the importance of isolation. I know isolation can be difficult, especially for those who do not have symptoms, but it is our best defense against COVID-19. For those people who do not have symptoms but are a high-risk contact, meaning you've had significant exposure to COVID-19, isolation is absolutely necessary. People can still spread the virus when they don't have symptoms. This is what we mean when we say asymptomatic transmission, and it is one of the reasons that COVID-19 spreads so quickly. Some people with COVID-19 can spread the virus at least 2 days before the first symptoms develop, and others spread the virus for up to 10 days without developing any symptoms.
Ula sakut ulo me kau sa kumbayo nga kanok taman na nuwad jo anak siya maso yung mga kamalo kanupin makayuti gining anit taili gaya kamne. Kau yung magalawak to nga anit taili tita ulo ni ayong nakto ni nga ni pilawak to mitay ko nga kano ikut hangit tunod kasi ani taman na sa pumayaw ko tigit siya kan na nakparigat tigo nuwad jo anak 19 mik. Tay ko nga kano ikut hangit tunod kasi ani katiyaw si mayo na ulo ka anak tumigon nak tunod. So le mga katisi si mayo miniugot sinuwad jo anak 19 limik anit taili ni kasi ako bekangit tumipim mariyo ni hakto. Kikutuin na itse ang masigun nakto ay tuloy lutik nuwad jo anak mik hanoy guti hangik kalawar lutik. Tay mga tagaw kaw sa kakatak pabo hanoy guti hangik kalawar lutik siya maktit sigun nakningin. Tay may mapidyo tao katawag nuwad jo anak 19 kilami alukot ay tuloy tao gunangat siya maloni. Ilang inuwad jo anak 19 li siya may gunak to nuwad jo anak makko ulo kanoy guti kalawang ikalawak luni sibong ago asing ilo siya may gunak to nuwad jo anak ulo ni kulinik kanoy guti kalawang ikalawak luni.
Imagine the number of people you see in one day and then multiply that number by up to 10 days. If you're transmitting the virus during that time, you can pass it on to others who will spread it to even more people. By the time people know they are sick, they will have infected many more who will also be spreading the virus. To stop the spread of the virus, we need to isolate it. Moving people who are positive or people who are high-risk contacts from one house to another risks spreading the virus further.
Isumagayaw gaswalo ni tako katsiw ningit kikutuin na itako katak tati ulo tamat Tana may swakter lugu huli kag lugu mako ni ulo ni huli no ulo not tay matag siyang maktit sigun nakutis nuwad jo anak mik tay matigi tay ma ay tuloy gun nakutit asin not tay ma kawya malago vikane mayuge ami tay ma amisunik siyang maktit sisimagun nakutit sibong agun tay kwalo siyang mabitit asimini siyang may valya gun naksuti nuwad jo anak mik. Tan nukakti tau hullugai tullu tau valliani nga tan na nuutteili tau gealik anitteili nikkut. Takua nuvadjuanak tuliit on ubbaluunniit uluraanak tumiittu katijaussi majut illumio hatigingittu teimaa searmappalliakunnartu teimaatigi.
Isolation must be taken seriously, and the rules around isolation are there to protect the communities. If you are isolating because you have COVID-19 or you are a high-risk contact, you must stay at home. If you need groceries, have someone who is not under isolation bring them to your door and leave them outside for you. Do not go to other houses. Do not have visitors over. Keep your distance as much as possible inside the house. Wear a mask. Don't share food or utensils. And disinfect high-touch areas such as the bathroom, kitchen, and common living areas. I recognize isolation is not easy and it can cause a lot of stress, but if everyone follows the rules, it will help us contain the virus faster and will allow us to once again loosen the public health measures. Thank you.
Anitteili titaunir taanna pivitjuangu titaugiaqallarittuq tamakkualu atuagei malittaugialiit anitteili titaunirmut saputit jaugutiummata nunaqqatitsinnik. Anitteili hujaussimaguvit nuvadjuanak 19 haruvit ubbaluunni uluraanartumiigunnaruvit katijaunearnermut imeiluureahartutin. Angeqqarsimatuinnarlutit niqitaareaharuvit tarkua anitteili titaungittumut niuviutjaugiartungaahattarlutit silamilu taakkua aijaul ila aitsortaulutik. Asinginnut angeqqamiu ila illunu pulaareahattangillutit pulaareartautteilit ammalu qanitsaluatteilit illu iluani. Matuarsimainnarlusi taakkualu ameqqaahattangillusi nerineartatsinnik ammalu nerijutinik suurlusi puutinik. Taakkualu salumarsartaju nginnaqattarlutik attuqtaugajunnerpaat ubbalu tamakkua anarbimmi niqiliurbimmi ammalu pulaarbimmi. Qauyimagaluartung anitteili titauni ajornartuuningani kisianik lautamanna taqagutaugunnarngat kisiani kikkulimaa malippata atuagarni tamanna siarmatteilitin sarigunnartavu qilamiunersakkut tamakkua qasujauvallia kannilaaqhullugit aaneaqarnangittulerinnermu malittauqhujaujun quyannami.
Kent Driscoll, APTN National News. Dr. Patterson, how many reports has your office had of people ignoring the restrictions or self-isolation, and have these resulted in any fines?
Kent Driscoll, APTN kunnik Luta Patterson khatsiarti allabbiit qauyikkartausimava malingittunik ammalu akiliititaujoqalorsimava.
We've had a lot of general comments that not everybody is following it. For specific things where, we have a name and a date and those kinds of things that we can take more firm action on, we've had none like that, and so there have not been any fines issued for any individual breaking isolation.
Missuni tusaqattaqaluartugu qaussiutuinnartunik taakkua ilangi malingittugianginni malittaugiaqallarittunik kisiani tamakkuninga atinginnik qangakkuullungani taimakkuninga tusartitaulaorsimangittugu tammalu akiliititsilaorsimangittugu kikkutuinnarni siqumitsisimajunik anitteilititaugiaqartillugi.
Dr. Patterson, by my rough math over the weekend, as of Sunday, your department's tested around 15% of the total population of Arviat for COVID-19. 15%, 15. I'm wondering, is there a point where it makes sense to go ahead and just test everyone in Arviat?
Luta Patterson taakua naasausserinermuut isamagilaungaginaatsingujaulirtillugu pilirivissi qauyisarsimammata 15% nginni arviamiutait taimali qangakku isumaliurunnarsigajaqqi taakkua iluunnati qauyisartautsiammarigunnarmangaata arviarmiu.
It's important to remember that some of those tests are repeat tests where somebody will be tested 2 or more times. So although the number seems high, it's not 15% of the population. I'll let Uli translate that or interpret that. Sorry.
Pimariu Manila taikwa ilangi khawi saktaw likhatanga tatana sa inagalua taikwa makwati ungatanulun ni alla khawi saktaw likhatanga ta taikwa misokju yatu galua kisani 15% tingitangi vermio.
The problem with mass testing like that is it takes a lot of work and staff resources to do, and that would take resources away from contact tracing and the other things that we know can have a significant impact on an outbreak, and they will have much more impact than mass testing. And so as long as it's one or the other, we're most likely to aim for contact tracing and testing around people that we know have the infection.
Taman naila kaungilugu tauligunangat amisuni khawi sakto haktilugu tamakko piliriat sammayalo gayangat ekkanayak tillu piyat sakalo algayangata takko turaga hangartigattigu katijaw yuminang ni khawi sakattanangmut asingin nillo taman nattuini khamarigunangat siang mapallean ni uyu haktilugu kisani taman na kaunarnersammat amisuni ila katiyaw si mayoni khawi sanga khattarner mutay maymat khawi mayatin ne ser magbiu si mayoni tay ma turaga khangaktigu khawi sarner mo katiyaw si mayoni.
Jackie McKay, CBC News. Residents in Arviat who live in overcrowded housing and may have one person test negative or test positive and the rest test negative, they're feeling frustrated that person isn't moved out or they're not moved out of that household. Can you explain more as to why you would keep somebody who's positive with a bunch of people who are negative in one house?
Jackie McKay, CBC kunita ko vermiut illumio khatigi amisulo artillugi surlo ilanganik nalo na taw yo harnakkan nuwadjo nakto harninganik asing ilong ikamio khatingi na khawi saktamini nuwadjo harnangin naktaw tillugit sumata ko ang ikami ani taw khatangin mangatat ser martitsittarwanga taw hosrirnakyo.
There's a number of reasons, and it's a pretty complicated decision. Some of the things we look for is when did exposure happen? We're often finding them well after the exposure have already started. There's been many days or several days by the time it's identified.
Takwa jiging ito ni pidyo takakto taman na isa maliw ko tawag akam ni ngayong naktumat tayo ma takwa kawi sakpalle atillo takawi valle hattakat tamakwa siang magbiulirik tuminiw tillugi tayo ma siang magbiu simalirik tillugi nalo na taw simayo.
Some of it's capacity issues, that there's simply not enough housing to move everybody out. And in moving people to other housing, we may actually just be transferring infections from one house to another and then re-exposing another pool of people.
Ilanga pilawangwa ilapit yo tiulawangwa medyo tayo maene hatsangin ng mot illu ni amigar siningin no tayo may man ila nupter sigun nangin nata solo nupter tsigalo ako talo ilanga ni ang ikariyaw ngitumut asing amin ya tayo ka ni ang ikariyaw nga tumi siya makitsingali kaya kumiman.
My next question might be better suited for the health minister or the premier, but I'll let you guys decide. Another resident of Arviat is saying that they're worried that the grocery stores, people can't get deliveries if they're in isolation, if they don't have credit cards, and people are scared to go out and deliver people who are isolating groceries. Is there anything the government can do to help support?
Takwa arviamin me haksima yo hammin mani mai samalum na raksuni tamakwalo niuver bimme angekangano rujo yo harun nakalo aktilugu kisani out tayo me akili chane utsakangin mata mesut amalo takwa nuvajo nakto hangite kapiaso katangata angekamino ila angekariyo yo no atsigiat sa neriyat sa yo ne government ko kanu tamatumungay kayo runakan.
Thank you for the question. I know that the hamlet is working on delivering food packages there, and as for the government here, we're also working with family service to see how we can get around this. Not only just delivering food, but also so that people on income support can get their evaluations done through the phone. So we are working on that to make sure that no one goes hungry and is not left out in the cold. Out in the cold in terms of not having food. I mat na ta na aperiga pe kau yuma yung ta ko ham na kut pilira ya ta ko na kini niwang na law mata ma agjak to ilutit arba mi tanun. Matay ko na kay to hok to ta na pilira ya buma na tay ko na kay to anin ni ayok to na kay to takto na kita na mata agjak to ilut Iqaluit ta na huli kamagi bu pilira ya bu huli tay ko ka kung inap tigo tay ko anin ni ayok to na kay to hok to tay ko li pilira yo kawi mga matay ko na ko credit card kakto ni ayung ni map matali matnam.
I'm going to turn to the Canadian press. Dr. Patterson, please. Just to follow up on Jackie's question, has there been any additional space provided for isolation? You mentioned in your opening comments there that there are certain households that have high-risk individuals where they can't be in that household if there is someone infected with COVID-19.
I'm trying to Canadian press ko ni ta na Jackie at ko tiga kaw yang aperiga kan ne mayanga ta ko asik kan ni ni tsaw gun nakto ni ani television gun nakto ni nalo na taw sa mayo hakka ta ko ilang yang kami hatigi so luno va jwa nakto 19 ta sa mayo hakto mi ni utilugo inigiyaw kay nakto mi.
There have been a few times in the past where it's been appropriate to move people out of high-risk situations, but there have been none identified yet in Arviat.
Kaya ngunit hindi tayo anitit si kayo nakataron naktugo tamako sa makbiuli ko nagit lalo na yaktaw si mayo ni nitsagi yaw kayo nakto ni kisya ni akvya mi mana lalo na yaktaw si mayo hangit nubyo kayo nakataron nakto ni.
And are you able to tell us if community transmission is still occurring in Arviat, or are these still contacts that are coming up?
Nunalin ni sa mapalya mga akvya ni kautigod nakitigod o baluta magkwa katiyaw yuminyo yunit sulikaw yupalyawan.
We're still finding evidence of community transmission, but we don't know for sure if it happened a week ago or just recently.
Sulikaw yupalya yuguta magkwa nunalin ni sa mapalya ni nga ni kisya ni hangak ko mga pinasaw si ulawak tumiluni hangal latang mga kaw yung mga itugod sa mapalya ni mininga.
I'm Megan Dooling with Nunavut News. To follow up on Jackie and Emma's question, if there were high-risk individuals identified, is there places in Arviat to move them to if you needed to?
Megan Dooling Nunavut kun nita napik ko tiyo katak tu napik igiakan naktok tamakko kaya naktumigon nang naksayot ang vian ni nalo naktaw si mayo kakano daw kay nakatakon ng mga ta.
Yes.
To Minister Kusugak's message, this is a question for you, but his message was for people to follow the rules in the isolation hubs. Do you have any more information at this time at the origins of these cases in Nunavut? Do you know if they started in the hubs?
Minister Kusugak kakamo just siya ko yitso ni malitaw siya ko yilo ni tamak ko ni malitaw yalin ni tuyo mi bindikan lo na ni television ni to kasi naksikan ng sumabata ko ano na bumi tay maay tulutaw ng mga tataw na nito yung mi binni.
No, not at this time. We're still looking into that, but our first priority again is on breaking transmission in the four affected communities.
Agkaman na yung taman na hawi sa mga itabutan na ila sa bulak pautin ng nakaksimagak ko. Nukakita ko lugos sa mapalyaning nunalin ni.
Trevor Wright, Nunavut News. What are the factors in identifying community transmission, if not by portion of population or and whatnot?
Trevor Wright, Nunavut News Connecta ko kisuvat ilulingi nunalin ni siyang mapalya ni raktaw ni aktilogo ilay nang inot yut sawa nunakatigi.
For our purposes, community transmission is when it's moving from household to household and we're not aware of the epidemiologic or the transmission links that have triggered that to happen.
Taman nalin ni sama palianek imana lo na kataktagut angik asingin angik kakayaw yun siya mapalaya katatilugo kisaya na kayo mangitigo taman na siya mapalaya yun lirini pidyo tigilugo nakita ko pigyak si mamangata siya makbiw si mayo.
Are we expected to see more recoveries take place in the near future?
Niriyo nakatamak ko kanoy kun ni palaya na amning animan na sa sibunit sa tinni.
Yeah, the typical figure is 10 days after onset of symptoms or after a positive swab. So we will start to see more and more people as time passes be declared recovered.
Ullo huli na alaw tilugi tayo mga kanoy guti kakpalaya yung miniulak tilugo palaw ni kaya sakta ulok tilugo nalo na tayo ulok tilugo tako ullo huli na alaw tilugi tayo mga nalo na sa balaya gun naksikatak tugo tayo mga kanoy guti kakun ni kayangin ni.
Ulakot CBC kun ngakhlunga tobi utaw yung Taimatakot siya magpadleningit, inugyak si badleningi o kausara yung nakpyo kano unikang urang mangat. Can you describe what the trend means?
Which trend are you talking about, Toby? Like in terms of the numbers that we've seen over the past couple of days?
Yes.
Increasing trend.
Yeah. So the numbers are what we would expect to happen. It takes 1 to 2 weeks for public health measures and contact tracing and those other things to take effect, to kick in.
Ita ko hatsuning ita ko amisong ngapalianing ita maniriw na kataktot ataw si pinasa ko si makulo ni ita makwa kitawlok tilugan na hanang itulari na mamalita ko yawot ang malokati jamin niyo yo kaw yasaktawlok tilugi ita ma niriw na kataktot amisong ngapalianing ni.
The other thing a lot of people are paying a lot of attention to the day-to-day results. Those are not that important. They're not very good at reflecting what's happening with the illness because there's a lot of other factors that impact how much and how often we're testing, and things like flights and availability of pilot time and weather and all of those things can impact when we get samples and thus when we can report them.
Tamak ko aloy kiko tuin na nurjik kaya sakta tuin na lakit naksayo ya mataman na yo ullo tama sakit pa wakat sakit palya yo hatsiuning inni taman na pimariw na kalawang imat ila to ka ngalawang imat tamatumong nuwadyo anak tularin ng mut tamak ko adjiging ito ni pidyo ta kakatangata sidsik ta padlaya katangata hatsiuningin tamak ko pidyo tigilugi surlo hangata yu tikigun na katangingit ako tingit alo kanu tigi hangata kataon nang ningit sila lo pidyo tigilugo ang malukaw yung sakat sayo tamak ko tikit itaw katangingit tamak ko isa malugi ngakati.
Tema pinaswa ko siya nung ni inugyak si Kadla raw ming mat 46 karu raklutik udlong ni makong ni. Inugyak kanyu yak tuminiriw lwak pita. Over the weekend, for those 2 days, the total added up to 46. Should we expect more positive results in the near future?
Yeah, I think it's inevitable that we're going to see more positive results over the next few days. It'll really be end of this week, early next week when we start to see if we're making a difference in terms of dropping the new cases dropping as an indicator that we're breaking transmission.
Tayo may news sa tuwin na nga tamak ko nalo nang ito kamisong palya katalang ayo kawi yaw palya yun no vadyo anak tunik ulugalaw ni akto ni Teemali taatsuma pinasaarussiu nunguani palu pinasaarussiulaartumi haujuvaaligunnar silaaqaluartugu taakkua kanuiliurutauju ikajornerharpalliammangaata suurlunu taa naluneertauvalliajut appasippallialiqqata taimaa haujuvallialiqajartugu tamanna siarmapallianingani noqqartitsivallianertinni.
Kent Driscoll, EPTN National News. Dr. Patterson, Arviat has the majority of the cases. What happened or is happening differently in Arviat that accounts for those high numbers?
Kent Driscoll, EPTN kun nilutaa Patterson taakkua arviani amisuunarpaangummata khanimakkiangai taakkua amisuunarpaanguvalliataqhan.
Some of it we don't know and may not ever know for sure. Some of it is luck, and I'm not trying to be flippant in that comment. What we know from looking at COVID-19 and the spread of this infection worldwide is that the majority of people, or many people, don't spread it at all or spread it only to their household contacts, and then every once in a while some person or one or more people trigger these so-called super spreader events, and that's maybe 1 in 5, 1 in 10 of people with infections. And exactly why that happens, why we see this pattern, is being researched actively as we speak, and we're figuring out all of the different things that can trigger that.
Ilangi haujamangitavu hanute mei palleahattammangaata ammalo haujamalausmadjaangitavu tamakkuninga ilanginni kiseeni teima sullu niriunangittukku teimeilikallaggunnangata tamannat haujamaleqtavu nuvajjuarnar 19 teima nunarjualimaami taakko amisuunirsai searmatitsikhattangittuugaluat kiseeni angeqqamiuhatiminu searmartitsigunnartuugaluat kiseeni asinginnik Adjigingituni taakko ilainnangit searmartitsigunnangata amissuni kattuminiuluti haujamangilluti taima tamanna hanoq haujasartauvalliaju nunarjuami kissunu tamanna searmapalliatitsillarinneq hanoq pigiaqattarmanga.
There's some other things that we know are a problem that we can't control, like housing. Overcrowded housing is a big factor, and that's just something we have to accommodate right now. But right now, at this moment, the most important question is what can we do to stop further transmission? And that's the things we've been talking about today with isolation, avoiding avoiding spending time with people outside of your house, wearing a mask when you're out in public, washing your hands frequently, and maintaining distancing and separation.
Asinginni pidjuta hattarmiu tamakkuninga kaungiliurutiujuni tamannali pinarpaanguju tamaani nunavummi illumiuhattigit amissuulaartillugi taanna pidjutaungunappaaqattartoq taanna samaaluutigillaarigiahartavu maanna inihartitau kannerunnarmangaata ammalo tamanna noqqartitauhullugu searmapallianinga taimaimma taakkua malittaugialinne naluneersiinnahattaqqugu suurlu ullumi tamakku anittailigiaharne pimmariunerpaanguninganik angeqqarijaujumi anittailitsiahattarlutik matuarsimainarlutik aggasiluwaasainnaqattarlugit ammalu inuuqatitsinnik qanitsattailitsiahattarlussi.
Dr. Patterson, has anyone else been hospitalized or medevaced, and what can you tell us about the range of symptoms that people are having?
Dr. Patterson, kinatuinna taakkua aannearbialumuortaugiaqartoqarsimava tuavernartukku ammalu qanuigutiraqattarninginni.
No, there's been no, I've heard no reports of medevacs due to COVID-19. The range of symptoms is quite broad. There's 40 to 50% of people have no symptoms at all, even for their entire 10 days. Some people have very mild symptoms. Other people feel like a very bad influenza, you know, that fever, chills, widespread aches, and feel like they've been hit by a truck for a couple of days.
Hit by a truck. Tusarsimangittunga ullumimut qangatayuukku tuavernartukku tuqarsimammanga nuvajjuarnarpijjutigillugu ajjigiingittuni qanuigutiqarunnangata suurlu 40 balone 50% ng itamakko kanu iguti hangit sa makakatakto ulo ni hulinik ilangi kanu iguti arjo kakalawaksutik ilangi solo kanu masita tutito solo utir naksutik hueso kataksutik balone no nasum apok taminaluk tito.
Mathis Harvey from Radio Canada has a question. She wants to know if you have a more precise idea of how COVID-19 got into the territory and how are you going to make sure it doesn't happen again?
Mathis Harvey Radio Canada kunna periyok nalunar siga kannerun nakhiano taman nanunavo mo tikilatar ng mga.
No, we don't have a more definite idea at this point. It's probably a cascade of events that, in multiple steps or a chain of things that it would be easy to point at one spot and say, okay, this area is where it happened and we need to fix that. But that, when you're dealing with a system like this, that may cause more harm than good. So we need to make sure we've identified all of the weaknesses and try and fix them all at once.
Aga, lalo na sa malaking ito may kaya mayakang ito ko. Kasi ni adjiging ito ni ima taman na sakapalalang ni adjiging ito ni pidyo te kakso ni taman na siya mapalala kasi mayo. Ayok na kayang ito galawa tao sa minalo na si galawa gaso aruta kasi ni taman na ito te kakayang ni mat amalo akaw ngilo ko tiyo naksawa kayang kasi ni kaya mayatin ni malito taman na kipalaga sa tabo malitaw gali pidlogin.
And as a follow-up, she mentioned that at a previous update, you had said the rising cases in the south could lead to other cases in the territory. Do you plan any changes to protocols in the isolation hubs?
Aperikan na tuta ko lalo na sila kabitamak ko amisok ng palyaning ino kalo na ni amisok ng palya ko tagun na matatamani tamawin Nunavut may kasi ni pamda si mabita ko malitaw gali asidjak taw lang mga ta.
We've made some preliminary changes already. The number of staff have been increased in some of the hubs, and we've tightened up the ability to maintain the current policies. As far as changes in the policies or other operating procedures, that depends on what we find with the reviews that are happening.
Sebulak pak seuteniasid si kardut si mayugot surlo iqanayatit amisong ngorta si mayuta na ni tuyong bibini no tu kay na biugalin ni ammalutamak ko sangitiga taw si mayu malitaw gali tamalo asid si khatar na taw malitaw gali khawju balle yagut malitugo.
Jackie McKay, CBC News. We keep hearing calls for people to follow the rules in the isolation hubs. Since COVID came to Nunavut, have you noticed a change in people's behavior in the isolation hubs?
Jackie McKay, CBC kunik to say nakatatamag ko malit siya ko yung katamningin nito yung may anit daily view titaw yun ito tamag ko asid just si mamanga ta kanwili ko singi how is si mabin.
There's always been a small percentage of people who are struggling with following the procedures in isolation, and we do hear stories of people purposefully trying to break the rules or the rules that are in the isolation hubs, and in doing so, they need to know that they're not only putting themselves but their community at risk.
Tayo mga lima tayo ko katsin na galo presenting itayo mga malikat tangin mata to sa katak so talo pinakakin lutik si kumit si katak to nitaw na nito yung may inutuviw galin nito ni tayo may liok tilugi iminito ngitok ulukanak tumitit to kasi nitaw no nakatimi ulukanak tumitit siyo tayo ko malikat tangin ito.
One thing I need to make perfectly clear to everybody is this is not aimed at any one person. We have no reason to think that the individuals who are amongst the first cases diagnosed, we have no reason to think that they broke isolation or did anything that could have triggered this.
Kasi nung nato kasi umayaw siya ako nakparay matay ko ito ila pasitsingit tunga kinatuin nang mik pidjuti hangin na mapasitsiga hang nang mik tako sibulak pa mi nuwadyo anak talaw tun uhaus ringi takke mas ako mitsi juminiugiangi anit taili titaw biu jumi pigiartit si juminiugiangi ni tayo nalo narsingit tunga.
So far, all the new cases have been contained to the 3 communities. Is it too soon to know if the virus is in other Nunavut communities?
Ulumi mo ila tako pingasuni nunalin ni sa magbius si maningin nito sa katakata kilami ulwak kakaw yiga swakot asingin ni nunalin ni ilang mga nuvatsuang na.
4 communities, actually, counting Savikataaq, Rankin, Whale Cove, and Aviat. It's reassuring to know that we haven't seen cases in other communities, but it can take a little while for, if there's hidden transmission or asymptomatic transmission, it can take a little while for that to show up. And so we'll be maintaining the 2 weeks of tightened measures on Nunavut's path for the full period of time.
Sita mani itu nunalin ni sanikilo amidlo tikira jami kanya sinang mi akvanilo kasi ni may sumalo nangikay na tuman na yasing nunalin ni mga kasi ni utakikay na laulo takawi kawi lak dugut surlu kawi mangit to make sang mapalat siya kangikalo ang mga umbaluhan wigut kangilutik tayo manubadyo ang naktohakto ang mga tayo may mata ko makupin na sa ako si pividyo ang uning Nunavut may malitaw galin malitaw kay kanit si maniak to.
I'm returning to the Canadian press. Last week, you estimated that most of the people who have COVID-19 are younger people. Can you give us more information about the individuals who are positive right now?
I'm trying to Canadian press kuni pinasa ako sa ulawak tumiyo kayo gawita magkano wadyo ang naktas si mayo yung mga magkutunak sa uninginik o kaw sa rigakan na rin nakisulitan man natin may mga
50, maybe a little bit more, 50% are under the age of 30 in Aviat, which is not, shouldn't be a surprise because half of the community is under 20 anyway. So, but it seems to be largely, right now, largely spreading amongst younger people, which is consistent with what's happening nationally.
Abangin 50% ting itako kiyo hak to 30 akviani taman na huwasang nang ito tamak ko ila akviami utait abangit 20 niyo kiyo hangata tunganilo manaw yung makunak sa taman na sayang mapaliakat takto kay matchay makanata mi kay may kayong matay may medyo tawani.
And you said the review is still ongoing to find out how COVID came into the territory. Who's conducting this review?
Ako sa kagabi kaya sakta makano taman na nuwadyo anak 19 na bumbo ng mga kinakuno taman na kaya sakta ba?
There's a number of people looking at it at different ways. There is or was an environmental health officer from Nunavut who flew to Winnipeg to inspect or review the sites specifically. There's some other staff who are skilled in infection prevention and control and another environmental health officer who are reviewing the policies as well. And there's a public health physician trying to look at links. Manitoba Public Health has been involved in some of this review as well, and we're using some of their information.
Adiging ito tamat tuminga kaya sakto adiging ito ni pidyo te haksutik so lawa tilirin mo kaya sakti mi tamani ngak to mi Winnipeg mo to haksimalaw to tay kanito yung review ni Khimek kila kaya sa kaya tumik asingil kana yakti tama tuminga siya maktailit sinang mo kaya mayitaw yut ato agak ni khimek ko yut amalo lutamik kaya sakto hakilo ni kisunuto ang mga Manitoba miloan na ham nang itulirikot ikayo kataw min matatay ko at to kisigaro tingin niya to katak medyo gupiliri katigit to ta.
Megan Dooling, Nunatsiaq News. How do you know that the 2 people who had COVID-19 in Iqaluit are recovered, and how will you know when to stop contact tracing there?
Megan duling nunat sa kuning kanu kau yung mabita ko makko nuvat yung natas malauto sa ni kilo ame kanu igun ningin ni kambalo taman nakangak ko kati yami niyo yun ni kau yung sang ninok kalaka.
There's a worldwide accepted standard that from the time somebody starts symptoms or the date that a swab was collected, 10 days later, they're no longer infectious.
Nunat jole mami anget tau sa mayo mi tema malikata sulu pigalak tumini lauk tilugi hanu igu tekak palya ng mut amalo kau yasak tau lauk tilugu tema ulu ne hulu ne tema nalu na gunne hatak to hanu igu ne palya gunam ni.
And that covers the vast majority of people outside of the hospital.
Outside of hospital.
Yeah, who didn't need to be admitted into a hospital.
Ni taman na tayo may hatak sa mayo nunat jami tayo anak bimura atong ito ni tayo kanu igu ne ko tekahatak ningin ni.
For contact tracing, once we're no longer finding new cases and we have everybody who's a contact in isolation and we know whether or not their results have been positive or negative, then we'll pause the contact tracing itself.
Taman nalikati yamin niyo yun ikaw yung sam na kangak ko nukati tayo lang mga nutani nalo na ito yung hakpalya yung nitilugo balo kati yamin niyo yung inutuvin ni tayo kanu yung nitilugit balo ni nalo na ito nakalawak tanu badyo anak to haningin ni taman na nukati tayo balya lagayak to kati yamin niyo yun ikaw yung sam kanu yung nilawak tilugin.
And the outbreak itself is declared over 28 days after the last person was infectious.
Taman nalo sa makpanli New York ima isulid na kaktawa yakto ului 28 ta nakingulak pa nga ni siyang maktit sigun naktok pigyalok tilugunik 28 no ulo nun.
And there's been a lot of talk about vaccines in the media this past week. Have you heard anything from the federal government about allocations in this country? And how will Nunavut go about distributing vaccines once they get them?
Ako sa kakto kasi mamakin matamak ko nga kaputin ni tamat sumungan na wadyo ang nak 19 minok kakutawagun nakto ni pivalya yun ni gavamatok ko ni ito saksi mabitaman na luto ni yaw lang mga tamalu kanatame kanatamak ko sa maktaw lang mga tila to ni kaktaw lang mga kaputi at yun na ulit kata.
There's been an awful lot of discussion, and a lot of it depends on which vaccine, the nature of the vaccine that we get first and how much we get. As a isolated remote territory, Nunavut will likely be one of the higher priority jurisdictions, but we may still not get enough to meet all of the territory's needs right away. And so then we would aim for higher risk groups within Nunavut, so elders, care facilities, frontline providers who are in contact with a lot of people, situations like that, and then work out from there.
Thank you.
Taman no how susima yung makita makko nalia kaputi at win nakakala mga ta amalo kanutig at win naktakala mga ta tamak ko ito vimito ila taman na nga sit tumitillo ta ukil tak tumitillo ta na vuminalo nang ito sibulyo jaw gayak tugod kasi ni ami katwin na kaya kalanga ta tayo may matawaga hakalak tugod tamak ko nga sibulyo jaw galin niksurlo inam marinik amalo ipigiyaw vi haktunik amalo tamak ko nga ino kasanik kanaya binita ko kataktunik.
Dr. Patterson, could you explain for the folks who are getting contact traced, how confidential is contact tracing? An example, someone was visiting someone else and their spouse didn't know. If they report that contact, does it get back to the spouse or is that confidential information?
Dr. Patterson, ako sa kakong nakita magkuha kaya saktaw kataktaw kati si Jumini kanutigi kang gunapsit Juti giningin nito saktaw tayo liga kakatang mga tasurlo ay paki tayo mga tusaw tigayak ka tayo mga kaya mga tingi kaluang luti tayo mga katis sa yung mini.
We try to keep it as confidential as we can, so in a situation like that, we may contact the other person and say, we believe you've been exposed to COVID-19, and then, work out from there without giving names and avoiding as much detail as we can. Depending upon the circumstances, people may be able to figure it out. It's hard to know. But the contact tracers, especially the ones who've been doing this for a long time with other illnesses, are quite experienced in getting the information they need to do the job without giving away the confidentiality that people are trying to maintain.
Kaman tusak tau ya hangit tu ni kung unak tu ni tusak tau itu sehatak tu gupiyon nang nilimatin ni sulu kau ikak tau yo kalau tiluwi manu bajuan nak 19 limi katis yumini unikak tau tiluwit ilan niku atir ni kamalukik ku ni lulingin ni kau sekatang itu gut kesan tamak ko ilang nalunang itu kau yakatak tu tay manu nalin ni miku yuti mata Kisah ni tahu tamak ko katiya minyo yun ikaw yung sakti ako ni alo tamak ko ni nga ito takak si mamata kau yung matsak sutilo asingin ni siya masu ni tayo mga kau yung sakatak si mamata tayo matusak tayo gali to ani tayo matusak aso akatak to asingin ni tusak tayo litit silo ti kang ngunak to ni.